So the basal ganglia is a collection of gray matter within the cerebral cortex. Now let's talk about its functions. So basically it is involved in posture and voluntary movements. The corpus striatum receives the efferent fibers from the cerebral cortex, the thalamus, the subthalamus, the brainstem, and the substantia nigra. And then there will be the integration within the corpus striatum again, and then the outflow will travel into the same regions from where the input came from. The cerebral cortex, the thalamus, the subthalamus, brainstem, and the substantia nigra. The premotor and the supplementary motor areas of the motor cortex, the primary sensory cortex, and thalamus, subthalamus, brainstem, and the substantia nigra. They're going to carry the outflow signals of the basal ganglia and channel them through the globus pallidus, which controls the motor activities of the cortex and the brainstem. There is no direct control with the descending pathways to the brainstem and the spinal cord. As a result of that, there is learning of motor skills and voluntary movements. So the basal ganglia is involved in writing, drawing, singing, and looking. All of these are the skilled cortical motor activities. So if there is damage to the primary motor cortex, what will happen? The discrete movements of the hands and feet on the opposite side will be lost. However, if there is destruction of the corpus striatum, there will be paralysis of the remaining contralateral movements of the hands and feet. Furthermore, the basal ganglia is involved in the execution and the preparation of the movements. And it is also involved in the axial movements as well as the girdle movements. And it is used to position the proximal parts of the limbs. The activity in globus pallidus will increase before the initiation of any activity, and the trunk and limb will be in appropriate position before the primary motor part of the cerebral cortex will activate the discrete movements of the hands and feet. Now let's talk about the corpus striatum. Corpus striatum refers to the lentiform nucleus and the caudate nucleus. It is lateral to the thalamus and it is almost completely divided by a band of nerve fibers, which are the internal capsule, into the caudate nucleus and the lentiform nucleus. The term striatum is used here because of the striated appearance produced by the strands of gray matter which passed through the internal capsule and connecting the caudate nucleus to the putamen of the lentiform nucleus. So in this diagram, you can clearly see everything. So you can also remember this diagram with I by I, which was the sign for arterial. Okay, so here we have lateral ventricle, which represents Y. As I, we have putamen, and we also have to draw these in between. These are the caudate nuclei. And what about this? This looks like the lungs. These are the thalamus, and inferiorly we have the third ventricle. And what are these? These triangles are the globus pallidus. So the neurological structures and their nuclei. Caudate nucleus, caudate nucleus. Lentiform nucleus consists of G and P. Globus pallidus and the putamen. Claustrum, claustrum. Corpus striatum consists of the caudate nucleus and the lentiform nucleus, CL or LC. Striatum consists of the caudate nucleus along with the putamen and amygdala. So basically, this is the lentiform nucleus. Here is a wedge-shaped mass of gray matter and BBC, which means the base is broad and convex, BBC, and the blade is medially directed. This is a blade, this is medially directed, and the base is going to be broad and convex. Else about the lentiform nucleus. Lentiform nucleus is deeply buried in the white matter. It is related medially to the internal capsule, which separates it from the caudate nucleus and the thalamus. And it is laterally related to the thin sheet of white matter, which is the external capsule. Here is going to be laterally related to the external capsule, and then external capsule is going to separate it from claustrum, which is going to be a thin sheet of gray matter, and claustrum is going to further separate it from insula. Vertical plate of the white matter is going to divide the nucleus into darker lateral putamen and pale globus pallidum. Inferiorly, the putamen is going to be continuous with the head of the caudate. Talk about the caudate nucleus. You can see right here, this is the head of the caudate nucleus. This is the caudate nucleus. So the caudate nucleus is a C-shaped mass of gray matter. It is closely related to the lateral ventricle. It is lateral to the thalamus. It is closely related to the lateral ventricle, and the lateral surface is related to the internal capsule, which separates it from the lentiform nucleus. Now let's talk about the head, body, and tail of the caudate nucleus. This is the head of the caudate nucleus, this is the body of the caudate nucleus, and this is the tail of the caudate nucleus, and it is going to terminate as amygdaloid nucleus. Now let's talk about the head. So the head is going to be large and round, and it is going to form the lateral wall of the anterior horn of the lateral ventricle. You can remember this with LAL, LAL. And inferiorly, it is going to continue with the putamen. Superior to this union, the gray matter is going to pass through the internal capsule. Okay, now let's talk about the body. Body is going to be long and narrow, and it's going to continue with the head of the caudate nucleus through the interventricular foramen. And the body is going to form the floor of the body of the lateral ventricle. Let's talk about the tail. The tail is going to be long and slender, and it is going to be continuous with the body in the posterior end of the thalamus. It is going to follow the contour of the lateral ventricle, and it is going to continue forward in the roof of the inferior horn of the lateral ventricle. And it is going to terminate inferiorly in the amygdaloid nucleus.